Guys, welcome back to Medical Coding with Blue. Today's episode is all about advice to medical coding job seekers. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, seeking your first job in medical coding. As you may have noticed by now, it is a little bit on the difficult side because everybody wants experience. But how are you supposed to get experience if no one will hire you? Well, here's the thing. Most employers do not want to have to do training, especially to somebody who's brand new. There are a lot of fast-paced medical coding schools out there that are pumping out medical coders that are unprepared for the real world, quite frankly. And it's a lot of them that are out there like that. And so if they are going to hire somebody, they need somebody right away who's ready to hit the ground running. But it doesn't mean that it is impossible for you to get a job. And for those of you who say, well, Blue, I applied at 200 and 300 places and I just don't know what I'm doing wrong. I guarantee you there's something wrong with the resume. It's going to start with your resume, because what are you putting out there first and foremost when you're out there looking for a job? You have to have a really good resume. And a really good resume is 1 but no more than 2 pages, all right? And a resume does not go back more than 10 or 15 years of your work history. Now, if you are saying that you worked in the 90s, no one cares because it's too far back, number one. Number two, when they're running a background check, they're going to run from 10 to 15 years back. Some places run 20 years back. It really all depends. But for the purpose of your resume is just an introduction of who you are, right? And so you just need the last 10 or 15 years. And that's it, you know, and basically you also need to say the things that are transferable from the previous jobs that you had, even if you do not have a job that was related to medical at all. The questions you can ask yourself is, did I have to protect private information? Did I have to work with Excel spreadsheets? What are some of the other things that I did that could potentially transfer over? Did I have to follow specific instructions to do my work? And did I have to have direction? Did I have to have somebody constantly on me? With medical coding, you have to be very self-directed. You have to be able to be independent, and you have to be able to know how to do your research. Were any of those things a part of your previous job? Make sure that you put it down, okay? And it doesn't have to be filled to the brim with everything. You just need a few things. You don't have to have a whole paragraph of what you did in your last position that's not related to medical coding, okay? You have to also put on there all of the things that you learned in the school, and those are your skills. That should be on your skills. If you are putting on your skills list that you are organized, that you're a team player, that's an immediate rejection if I am a hiring manager, right? And the reason it is an immediate rejection if that is on your skills list, organized, team player, smiling face, is because that is not what I'm looking for when I'm looking for a medical coder. That's a soft skill. I am looking for hard skills on your skills list. What did you learn in the school? ICD-10-CM, that's what you want to put. If you say ICD-10, again, it's an immediate rejection. Why? Because there's 2 versions. There's ICD-10-CM and ICD-10-PCS. You cannot assume that I'm going to know what you're speaking of if you're applying for a job, right? So you have to be very specific. ICD-10-CM. If you learned ICD-10-PCS, ICD-10-PCS. You learned CPT, CPT. You learned HCPCS, you put HCPCS. You put all the things that you learned in the school. And if you say, well, Blue, I just don't know what employers are looking for. It's literally in the description of the job, right, when you're applying. And what else did they say that they want the candidate to know? Candidate must know medical terminology, anatomy, pathophysiology, pharma. All of those things have to be on your skills list, okay? So that's what employers are looking for. Again, this is just a quick snapshot of who you are and what you could potentially be bringing to the company. Now, if you did not finish, if you went to college, let's just say, for example, you went to college, whether you were pursuing an associate's degree or a bachelor's degree, and you did not finish, do not put that on there. Don't put it on there because you didn't finish that degree. And sometimes when people say, well, I'm going to go back someday, but that's not right now. And if you only got a few credits, you know, you may not ever go back. And so you want everything on there to be clear. You don't have to have a degree to get in as a medical coder. You don't. All you need is a certification. So if you're thinking that maybe putting down on there that you went to college may put you ahead of the pack, no, don't do it. Because again, that's not really what's going to get their attention. What gets their attention is your knowledge. And do you understand why you're applying for this position? Because sometimes people will say, well, looking for any position that will help me to exercise my skill. First of all, what is your skill? And what specifically are you looking for in a job? What job are you looking for? If you don't have that on your resume, again, another immediate rejection. So if your resumes are not tailored to the positions that you're applying, you are going to get rejected. And it doesn't matter if you're putting out 300 resumes or 400 resumes, for some people were saying. It doesn't matter if you're putting out that many. If the employer knows that you did not take the time to specifically tailor your resume and cover letter, and yes, cover letters are important, and cover letters should not be a regurgitation of what you have on your resume. That's when you talk about being organized and a team player and all that good stuff, all your soft skills, okay? But it is important to have that and make it to where you're talking about that specific position. And please don't complain to me about, oh, I gotta do that for everyone. Do you want to get hired? Do you want a job? That's what you got to do, okay, folks? Because there's so many folks that are out there just wanting things to be like handed to them, like, oh, well, you know, I did all this schooling, I paid all this money, I can't find a job, because you're not setting yourself up to find a job, okay? And so again, these resumes are going to people who are getting hundreds of resumes. So in order to make yours stand out, you got to be very specific about what is it that you want, or what position are you applying for. Are you applying for a coder 1 or a coder 2 or whatever? Coder 1, coder 2 are different everywhere, so that's why please don't ask for me to do an episode about that, because it is different everywhere. Everybody considers coder 1, coder 2, coder 3 different, like they do different tasks. So again, it just really depends on where you're applying. So again, make it to where it's specific for that facility, and then apply. And trust me, guys, it doesn't take that much time to update those names of the positions, so that way you can have yourself a greater chance of success, okay? So just make sure that you're doing that for every single one, that you're changing the job title that you're applying for, and that you're making it specific to that facility. Know where you are applying, okay? That is very important, because if you do get a call back and they say, well, you know, what do you know about us? If you say, I just know that you're hiring, I wouldn't call you back either. I'm just saying. So the other thing is, you have to not look at their requirement or their request for experience as a wall, okay? You can't look at it as a dead end, like I can't apply for this job. You go ahead and you apply anyway. And do you know why? Because if that employer is not getting anybody to apply that has lots of experience, because if happy coders are in that area and they are happy with what they're doing, they are not going to leave. So then that employer is going to be at the mercy of who was ever applying. So if you showed enough initiative to apply, then you're going to have a greater chance of getting called back versus somebody who never applied. They're never going to know who you are unless you apply. So even if they're asking for 3 to 5 years of experience, you still apply anyway, especially if that job is for a medical coder. Now, if it's something for like an auditor where you're having to audit other medical coders, don't apply for that, guys. You're not even there yet. Or a CEI or something like that, CDI, clinical documentation integrity. Don't apply for that, okay? Especially if you're brand new, right out of the gate, and no experience in coding. You don't want to do that because that would be wasting the employer's time. But if the job is to apply for a medical coder, you're a brand new medical coder. You're coming in with no bad habits. What is better than that? And you are freshly trained, and especially if you have prepared yourself the entire way and that you have made it to where you're still practicing in the book and things like that. So when they give you an assessment test, you can be prepared. Now, these assessment tests are going to be different everywhere you go. Everywhere. They're so different. So you just have to be prepared for anything, which is why I tell you guys to continue to practice with your workbooks, especially when you are in that job seeking process, because this is a time where you could easily start to forget, where you're going and stuff like that. So just make sure that you still continue to practice. So that way, when they give you the assessment test, you'll be ready, And let's just say, for example, their pass rate is a 95 and you make a 90. And, you can ask them, hey, that's technically a fail, but you can ask them, can I take this test again? I was just a little nervous, something. Show some initiative. Show that you really want to be there. So that way they may say yes or no. If they say no, okay, well, thank you very much for your time. Then you know what to focus on more. Whatever that test was testing you on, a lot of times they won't give you the answers or tell you what you missed. Because they have to protect the integrity of those tests. Because if you apply and then somebody else applies and then you give them the answer because y'all know each other, there's no way to gauge if that person really truly knows, right? So that's just one thing that, you have to just be aware of when you're applying for these jobs, because that's what they do, all right? But get out there, and once you start applying everywhere and you get your resume worked out right, you'll start to see the difference. Now, I have a lot of videos on my channel about resume tips for brand new medical coders. And then, of course, the tips I talked about just a couple minutes ago. But if you don't want to have to do it yourself, you want to send it out to somebody, there's a ton of resume writers on LinkedIn. I'm a resume writer myself. My rate and contact information is in the description box below. That's the thing, when you're out there and you're applying and you're writing all these things and you're doing this stuff, it's for your benefit. Some people don't feel confident enough in their own resume writing abilities, and that's okay. But at the same time, if you are going to farm this out to somebody else, make sure that they are a medical coder who understands, and not just somebody who writes willy-nilly for everybody but doesn't really understand our industry. Okay, you want somebody who understands our industry. So that's just what I'm saying. But back to the thing, back to the subject at hand. You want to make sure that you are keeping a positive attitude, because when you're out there and you're getting a lot of rejections, it's just part of the process. Everybody goes through this, guys. It's not personal. So you take every experience and every interview as the opportunity to get better. Because if it didn't work out for you at one place, it's because that place was not meant for you. All right? And not every place is going to be meant for you. And that's the ins and outs of it. And that's okay. If it's not meant for you, it's not meant for you. There's going to be another place that is for you. But the thing that you cannot do is you cannot stop. You cannot quit looking for a job. And just because you're not working, maybe you're not working right now, it doesn't mean that, or you're not working in a place where you want to work, right? But maybe you do have another job right now that you're working and you're still kind of applying for jobs, along the way. You can do that. I did that. I worked 2 and 3 jobs while I was applying for jobs for medical coding. So I still was able to do that. Was it tiring? Yes. But it was just a temporary thing. It wasn't going to be forever that I was going to be having to work so physically hard. And so that's the thing. You can't give up and you can't stop working. And you can't just get upset just because no one is hiring you. Do I know how you feel because I got rejected too? Yes. Yes, I do know how you feel. And I do know how frustrating it is. But I also know that this information that I give you guys is what I wish somebody would have told me from the beginning. To apply at a temporary agency. Temporary agency is a lot different from these staffing agencies. You'll see these staffing agencies all the time on LinkedIn that they're always hiring, always hiring. There's a few of them that are always hiring because they aren't a very good place to work for, from what I've heard. So that's just something to keep in mind. You don't want to apply at places like those. You do want to apply at your local temporary agency. You can Google temporary agencies for medical professionals. Every place is different. Please don't ask me which ones I recommend, because unless you come from my hometown, which a lot of you don't, then I can't help you, right? So Google temporary agencies for medical professionals, and all of the temp agencies that are in your area that specialize in medical professions will pop up. And sometimes you'll find that these temp agencies have contracts because they compete for contracts, right? And they need coders. And so a lot of times you're not going to have that experience requirement, right, to be in there. But they will give you a test, and they will make sure that you are at least competent to do the coding. And so that's a great way to start. Now, it may not be what you wanted right out of the gate, but a lot of you kind of need to get your wants and your requirements in check real quick, okay? Because there's going to be things in the beginning that you may not have expected, like having to apply at a temp agency and then basically being at their mercy of like whenever they're going to give you an assignment. It doesn't mean that you can't still apply for other jobs, right? But when you are applying, when you're getting these calls for these assignments, they're not going to be 1-day assignments. They're going to be like 90-day assignments, or maybe even 6 months, maybe even a year assignments. So it's going to give you time to build on your resume. You'll have like the electronic medical record that you had exposure to, the encoder that you had exposure to, the specific clinic or the type of setting that you had exposure to, the specialty and things like that. So that's all the things that you'll be able to add to your resume. And it's movement, it's forward movement, rather than just running around in circles and feeling stuck, right? And the other thing that I will say is this: do not complain on LinkedIn or beg on LinkedIn. I can't take care of my family, and I'm doing medical coding because I want to take care of my family. Please help me find a job. Don't do that, guys. Don't do that, because everybody has that story. Everybody has their reason why. But a lot of times when people do that, it's because they want to get frustrated right away because it wasn't handed to them so quickly. And sometimes they really did make a very, very strong effort to get out there, but maybe they didn't do their research and they tried to send out the same resume to everybody, okay? I'm not saying that those people didn't try hard to find a job. I'm sure a lot of them did, but there's a lot of them that I know they didn't, right? And so that's the thing. That's the difference between, somebody who's trying hard and somebody who's not trying hard, right? And they just want it handed to them. But don't go on LinkedIn begging for a job. When I see that, I'm just like, why are you doing that? The community of medical coding, though there are thousands of us, is very small. So they're going to know, and you are going to get a reputation, especially if you start complaining. I'll never forget that one lady that was constantly complaining, and people tried to help her and give her lots of recommendations on what to do and how to help and who was hiring, things like that. She had an excuse and a complaint for everything. And I just made sure that I blocked her because I was so tired of listening to her complaints. And I didn't feel sorry for her, especially when people were trying to help her and she had a rebuttal for everything that everybody said. And so if you are so ungrateful that you can't accept help when people are trying to help you, when you're saying that you need help, yeah, I'm done with you. So I blocked that lady because, again, I can't stand it. I can't. That's the one thing that I can't stand, is when people do that. When people try to help you and you have a reason or an excuse why that's not going to work, rather than just doing the hard work and doing it, and that person had a terrible resume. She posted it, and I could see what the problem was. And every single recommendation people gave her about, changing things up, she didn't want to hear it. So, okay, well, there you go, but if you don't listen to other people who have experience and who are trying to help you, then if you keep doing the same thing, you're not going to get a different result. I'm just saying. So make sure that you keep that in mind. It is a very worthwhile field. It is a very difficult field to get into, unfortunately, because it takes a very thick skin no matter what you're doing, right? Whether you're being a coder and actually being in there, and then you have to deal with audits and deal with providers and things like that. It does get difficult, but it is worth it. I've done a video this week about that the very thing. It is worth it. But it's not meant for everybody. It just really depends on how strong you are. And everybody has that ability to be strong. everybody does. And it doesn't matter if you're a shy person or if you're an extroverted person, this field accepts everybody, whether you are just at a high school or whether you are just coming back into the workforce after retirement and you want to continue working. It accepts everybody. But it's also a huge responsibility to be able to learn all of these things and to be able to do things the right way as far as getting out there, having a positive attitude, still continuing to apply, not giving up, and not complaining. I mean, when you complain, especially on LinkedIn or Facebook, you'll start seeing people have that same, same song and dance about either how they can't do it or, if people are trying to encourage you or whatever. You keep applying, okay? Just keep applying, and please don't be like those people that complain, okay? Because everybody's gone through this, and this is a normal part of this career. I call it part of the shaping process because essentially that's what it is, because it'll literally weed out people who just didn't have the stomach for it, didn't have the stomach for being out there and being proactive to get a job. And like I said, it takes a lot of effort to find a job. And some of the jobs that you guys can apply for, I mean, maybe you can't get into medical coding right away, but you can certainly try alternative jobs like medical billing, prior authorizations, or you can even do charge entry. Now, charge entry is not coding, but it does give you exposure to the codes, and it does give you some sort of learning time with the electronic medical record and things like that. And so that way you can put that as transferable skill so you can keep applying until you get a job in medical coding. It is possible, guys. You always have to look for the way to get in there. And even if you have to take another route to be able to get in, there's something wrong with it. Lots of medical coders started off in medical billing, all right? But if you're able to get in as a medical coder right away, that's fantastic. Just make sure that you continue to apply. And no matter what, if it's truly in your heart to do this type of work, then you will find a way. I always think back to the lady during the pandemic. The lady, her husband was in a nursing home, and they did not allow visitors in the nursing home at all. And during the pandemic, and the only way that she could get in was if she was a worker. Only workers were allowed in there. So she applied for a dishwasher position just so that she could get in there to see and hug her husband. And she got in. So she had to think of other ways and be creative. Now, I'm not saying for you to apply as a dishwasher in order to be a medical coder. That doesn't make sense, guys. Don't even apply for a secretary, because if you apply for medical secretary, you may get stuck there. I always say the alternative positions, medical billing, prior authorizations. There's another one that I can't think of off the top of my head. But apply for those and watch the videos that I have about alternative jobs for medical coders. So that way you can do something else to be able to gain that experience to be able to get in. But don't lose hope, okay, guys? Because it is possible, but you can't give up. I'm just saying. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.